Thanks for joining us for a chat with the expert. My name is Alexis Hunter, and today I am chatting with Dr. Rhonda Mao. Dr. Mao is a board certified in internal medicine. She's also certified as a lifestyle medicine physician. She currently practices lifestyle medicine at the Wilmington Health Monkey Junction location. Dr. Mao, thanks for chatting with me today.
Thanks for having me, Alexis.
Absolutely. So start off by telling us, what is lifestyle medicine?
So our daily habits can dramatically impact our health. And that includes things like what we eat, how well we sleep, how physically active we are, and how we cope with stress. When one of those areas of lifestyle is not as healthy as it could be, it can potentially lead to health problems. This can include weight gain, high blood pressure, high cholesterol, and type 2 diabetes. The point of lifestyle medicine is harnessing the power of everyday habits to promote health. So by making improvements in these lifestyle areas, we can prevent, control, and sometimes even reverse conditions that are common, like high blood pressure, high cholesterol, or type 2 diabetes. And making these changes can also help us to achieve and maintain a healthy weight. By doing these things, we can also potentially reduce chronic inflammation, which we know contributes to a number of diseases. Lifestyle medicine allows you to be in the driver's seat as the patient, to take charge of your health by tapping into the power of our everyday habits.
So important. But how might lifestyle medicine be a little different from the care that I would receive from my PCP?
So prior to focusing my practice on lifestyle medicine, I served for a number of years as a primary care provider. So I understand completely the challenges that sometimes come along with caring for the whole patient. There are a number of priorities when it comes to health, and they're all very important. And in the context of an office visit, it's sometimes not feasible to have in-depth discussions about things like lifestyle. Since I've made lifestyle medicine my focus, I'm able to dedicate the time to focusing on exactly that. And together with you, we'll take a comprehensive look at your current health status and lifestyle, identify some areas to target for improvement, and I'll provide you with advice that's based on what the scientific evidence recommends. I'll help you to set goals that you feel are attainable. And throughout the process, I'll provide you with support and coaching to help you reach your goals. My aim is for these changes to become a way of life. Together with you and your primary care provider, we are a team with you at the center, and our goal is better health for you.
Perfect. So what about for patients maybe who have tried unsuccessfully to achieve healthy weight through diet, exercise, etc.? How might lifestyle medicine be helpful this time?
So trying to manage your weight on your own can often be confusing. It's hard to know what diet is best or how much or what type of exercise is ideal. The guidance that you get can vary depending on the source. I will provide you with evidence that is based on scientific studies. This is much the same way that another provider might talk with you about a medication and provide information that's based on studies. The other thing that's important to remember is that weight isn't only about diet and exercise. There are a number of factors, the ones that we mentioned earlier, things like sleep and stress level and mood, that also have a big impact on what happens with our weight. When one area of lifestyle isn't as healthy as it could be, it can affect the other areas as well, and oftentimes weight changes do arise. An example in real life where this can happen is when we're feeling overwhelmed by stress. Oftentimes our sleep and mood are affected. We may not eat as well as we normally would. We may not exercise as much just because we feel like we don't have the energy or the time. And this is one of the ways in which chronic stress can contribute to a lot of health problems. In addition to weight gain, also things like anxiety, depression, elevations in blood pressure and blood sugar. The other thing is that when you're trying to manage weight, it's really important to focus on all of those areas and look at the whole picture rather than just one, because that does help us to be a lot more successful in our efforts. So through the Lifestyle Clinic, we'll take a comprehensive look at the whole picture, work to get your lifestyle back in balance, and move your health in a positive direction. Final point is that it's important to keep in mind that big changes aren't always necessary. Loss of smaller amounts of weight have been shown to lead to improvements in things like blood pressure and blood sugar. It can reduce arthritis pain and lead to improvements in energy and quality of life. So I am here to meet you where you are, help you set some personalized health goals, and provide you with the tools that you need to succeed.
This is fantastic information. Thank you so much, Dr. Mao. For our viewers who want to learn more, please visit our website, and we hope you have a great day. We'll see you next time when we chat with one of our experts.